My name is Richard Lochala. I'm from Mena, Arkansas. I've been practicing in Mena for the last 21 years. I started with electronic medical records in 1996. At that time, it was primarily a word processing machine, and I utilized that just for clarity and continuity. As meaningful use came along, and the funding for that was identified, then we elected to go to a more integrated system of electronic medical records. At that point, we evaluated several, and EMDs turned out to be the one that we chose to use. We started EMDs 2 years ago, and it was challenging at first, having all the volume of information that was required to put into the chart. Each patient became a new patient, so it was challenging at first, but as time went on and we became more used to it, that became much more beneficial, and we could see the benefit of that versus the way we were doing previously. EMDs has helped us significantly in the quality of patient care by integrating so much of the information with several parts of the chart. For instance, medications, any changes that are made in one place changes in the other part of the chart, and therefore you don't have to go back and move one bit of information into another. It's done automatically. This makes the e-prescribing so much beneficial, because as you're writing a new prescription, it becomes a permanent part of the chart, and you don't have to enter that information into a different place, and the two don't correspond in other methods. So this has been very beneficial for us. All the demographic information is very accessible, and it's very easy to use and manipulate that information. And then with the integrated medical records into the business side of the program, it has really helped us in our reimbursements. Using that, it's helped us to actually charge at a higher level than what we've been able to charge previously, because all the documentation with the review systems and the past medical history and things that we review every visit then brings us to a higher level of charging. Then as we went into the electronic medical records, the HIT Arkansas people came by and offered us assistance in meaningful use. They assisted us in evaluating our medical records prior to even purchasing them, and have been with us every step of the way, teaching us and telling us which reports that needed to be used to document our meaningful use. And then as we saw areas that we were lacking in, My business manager was been very aggressive in making changes in the front office and the secretaries in making sure that the demographics are there and everything is documented, and the nurses have been trained and have done very well in doing the other aspects of the chart to make sure that we meet meaningful use. They've held our hands through this whole situation, and it's been very beneficial to us and allowed us to be one of the first in Arkansas to qualify for meaningful use. And we're very grateful for them. And I'm very grateful for my business manager, Lori House, for her help and assistance with all of this. As far as electronic medical records, and especially MDs and the quality of care, which is really what we are focusing on, the reminder section of that, where a patient comes in and if they're diabetic, it reminds us that they need a hemoglobin A1C or a lipid panel, and that is done and ordered right as the patient is coming in for the visit. It also helps in every aspect: hypertensive, coronary artery disease, health maintenance. All these reminders can be set up and individualized for your practice to help you maintain good medical care and make sure that all the things that are necessary and required for good medical care are done and not forgotten in the heat of the moment. So this has really helped. It's made me more focused on preventative care and especially asking about mammograms and things like that. And there have been several patients who've always resisted mammograms, but we found one or two cancers in women who had not really wanted to do that until we pursued it and specifically asked them to have their mammograms as a reminder from the electronic medical records. So it's been very good for us in patient care. We have 6 healthcare providers, 2 MDs, 2 physician assistants, and 2 nurse practitioners. Absolutely, because all the information is there and well documented. And the charts and the laboratory information, because we have an office lab and that's integrated within the electronic medical record as well. And so all that information is readily accessible. And so it allows everybody to be on the same page. Well, a lot of it, especially the review systems, when being able to have a format where it's easy to do the review systems, there have been a lot of things that we've caught patients with chest pain that wouldn't have mentioned it unless I specifically asked, "Are you having any chest pain?" And they said, "Oh, well, yeah." And we find, significant heart disease. So the patients feel that we're doing a more thorough job by going through the review systems and being very thorough in that. And it helps with patient care. It also helps with a higher level of care. So we both win in that situation. But yes, they've appreciated that. There are fewer callbacks from the pharmacies because medications not being correct, forgetting to enter them, writing a prescription and forgetting to enter it into the chart. You write the prescription through the chart, so anything that's done is there, and so there seldom do we have callbacks because we didn't document the chart the change that we had made the previous visit. So there are a lot of things that the patients have enjoyed, but primarily it's the more thorough questioning for the review systems. So we feel like we're doing them a very good service. Well, this is really where our whole medical system is moving toward. The time of a 2-line office visit on a piece of paper is gone, and that was how it was when I first started medicine, and that just it can't be. And as I see the network of physicians going through and having a universal format for this information, that information is going to be a lot easier to transfer from one physician to the other. And that's going to be very beneficial. Now, when we refer someone, all the whole chart is burned onto a CD, and the patient takes it with them at the time. And so it's not you don't have office staff that are having to sit at a copy machine and copy that or faxing it. It just goes with the patient. So this is really beneficial in a lot of ways. And at my chart, at my desk on my computer, I can pull anybody's chart anytime. I don't have to ask someone to pull a chart, bring it to me. I make a change or make a comment, I send it to the nurse, and then she looks at it, and then it goes back to be filed. All that is so time consuming, and things get lost. With this electronic medical records that we have, it's all so seamless as far as the information goes. It goes right to me, and I make comments. I electronically send it to the nurse. She electronically sends it to whoever needs to follow up, and so it's really beneficial. Not to mention just being more thorough, having a way to document the things that you were doing previously anyway. It's just documenting the things that you were doing, and therefore increasing your reimbursement. So it's better patient care. It's better financially, and ultimately it will be better nationwide as people become more mobile and are moving from place to place. They can pick up a chart and take it with them with no problem. So, it's been very beneficial for us, and we're very pleased with this. Yes, it was. I mean, because every patient was a new patient, even though I'd been seeing them for years, you still need to document everything in the chart the first time, just like they were a new patient. Now, each subsequent visit is much easier because the information you acquire the first time, there are just small changes within the visit. If someone comes in for a diabetic recheck, all the previous information is there. You change the things that are pertinent to the visit, but you don't have to go back and re-enter everything in the chart. Same way with review systems. Once the review systems is there, you go through and ask them, but you don't actually have to make changes in the chart unless there are changes in the review system. Physical exams the same way. So in that sense, that's why for the first 6 months, I saw about half the number of patients that I used to see. Now I'm seeing about what I would see previously, but the level of service is at a higher level because I'm able to document the things that I had been doing in the past. The thing I hear from other providers is, aren't you afraid that you're going to get audited if you charge at a higher level? And I say, bring it on. We have nothing to hide, and everything is there and documented, and they can come in and look, but they're not going to find anything that we're not doing correctly. So I say bring it on. And as far as the technology goes and the ease, we had a very good IT person that helped set us up. I would not advise trying to take an existing system. I would not advise taking an existing computer system and trying to use a new electronic medical records, because you need to be at the top end of the technology, because it all changes so rapidly. And you don't need the frustration of a wireless network that doesn't work all the time, or information that gets lost, or having to redo a chart because the connection was lost. So you want to make sure that you get a good IT person and start with new equipment, just to make sure that it's as seamless as possible, because there will be other frustrations that you'll have to deal with. And you don't want the hardware to be a problem. You want the hardware to be seamless, and then you just work with the software. Well, I enjoy being able to work in the office from home. I log in from my house, and I'm able to review labs or things that have come back from home on my day off. And so that is a real plus. I used to carry home 2 satchels full of charts every night to dictate, and that doesn't happen when I walk out of the room. I'm finished. I don't have to do a lot of stuff out of hours.